The following program is presented by the Metropolitan Library Service Agency.
Hello, welcome to All About Kids, a program focusing on the interests of children and young people and some of the issues affecting them. State government is trying hard to make services more accessible to children and their families. Our guest today, State Senator Linda Berglin, will be talking with Bloomington School social worker Barbara Amram about the work of the Children's Mental Health Task Force. This task force made recommendations for legislation which would make accessing mental health services easier for families. Senator Berglin is the author of the 1993 legislation, Children's Mental Health Care Fund.
Senator Berglin, we're really happy to have you here today. You were one of the authors of the Children's Mental Health legislation. And could you tell us why there was a need for legislation regarding children's mental health?
We have a really fragmented system of serving children with emotional disturbances. We sometimes serve them through the public school system, through the county social services system, through the juvenile court system, through health plans. Sometimes when kids need something, they can't get any one of those systems to respond to them, and some kids are in all four of the systems and they're not talking to each other, and they do not often enough involve the families that these children live with. And so we're spending a lot of money, but we're not really serving the kids. And this legislation was an effort to make it possible for all of those groups that provide services to children, and hopefully in the future their families, to come together and to create one plan for the child, to pool their money so that they're not duplicating or acting in contrary ways in terms of their planning, and to provide maybe one-stop shopping for families.
Mm-hmm. What do you think the legislation has accomplished since it was passed in 1989?
Well, we have more services now than we had before, and we have, through, for example, Minnesota Care, an unlimited number of hours of outpatient services for children and their families now. Mm-hmm. Services that were never available in the past because there was no mechanism to pay for the services. We have more professionals available to provide services also. It's not to mean that we have arrived at nirvana. Mm-hmm. We still have a long ways to go, but we have improved the system.
Okay. How would the ordinary person, say a parent of a child who's acting out in school, having some trouble in the community, not paying attention to parental guidance, and they feel that this child might be having an emotional problem, how would a parent go about accessing the system?
Well, it's been a problem for people, but there are a number of places that parents can go. They can inquire with their health plan. They can inquire with their county. They can check with the school, with the social worker, about whether there might be some services available through the school. Mm-hmm. We're hoping in the future that we're in the planning stages now of bringing these units of government together, and we're hoping in the future there will be one place to go and get linked in with all of the various agencies, and there will be one set of providers that will be outcome-based providers. But we have heard stories in the legislature from parents who are so frustrated with not being able to get anybody to respond to their needs. I remember the mother who came to the legislature and said she was so upset that she couldn't get anyone to listen to her or help her with her child, that she was going to let him hit her so that maybe the juvenile court could come into the picture, and then maybe somebody would do something. Well, that's real desperation, and we shouldn't force families into that kind of a situation before they can get someone to listen to them.
What kind of a role can the legislature play in getting the providers to collaborate and facilitate the system for the client?
Well, what we have done this session, which just ended in May of '93, was to provide incentives for bringing folks together, a minimum of a school district and a county and a mental health provider. But we are hoping also that we will get the correction system, and we mandated the healthcare systems into the planning of how they can create an integrated children's mental health fund. And by doing that, we will be eligible for federal funds that other states get. But because we have such a fragmented, locally funded system, we are not eligible. So when a collaboration takes place, then there will be federal funds that we will be eligible for. And we're hoping with those monies that we will be able to plan for services to serve children at earlier stages. Because we know that a lot of times a child might be acting out their anger in response to a situation that happened to them sometime in their past. And it isn't until they're not able to be controlled in the classroom, they're not able to live in their families, the system is ready to take the child and remove it from its family home, then there seem to be some services available. But we need to start much earlier. If we can start earlier, close to the time that something happens to a child that is triggering this kind of an emotional response, we can solve it in a much more cost-effective manner, and we can solve it with that child and their family being kept together.
I think a lot of people would agree with you about the need for early intervention, and yet the system almost seems to be set up to provide funds only at the end in which a child is being threatened with out-of-home placement. I've heard that a lot from people, particularly in their relationships with county government. Could you tell us a little bit more about your view on that?
Well, it is one of the reasons I'm excited about this idea of leveraging some new money, because it seems as if we never have enough money to deal with the kids that are in crisis. And of course, when kids get in crisis, the services they need are much more expensive. And so it's kind of like a hole. You keep digging and you keep getting deeper into the hole instead of coming out of it. And really taking some of this new money that we will be eligible for and plugging it into serving kids at the early stages is the way we will get out of this crisis. Because those kids that get served early are not going to be the ones needing crisis care later on. And so it's kind of a chicken and an egg thing, but we do need to invest in the kids early.
These federal dollars that you refer to, where do they come from? How does that work?
They're funds that are available through the Medicaid program. And they can be spent on any kids, not just kids who are eligible for Medicaid. But you leverage them by showing that you are providing services to Medicaid eligible kids. And other states get this automatically. A lot of states get the money that we haven't been getting. By pooling all of our state and county and local resources and creating one collaborative with one pool of money, the state can then count that money and use it to match the federal funds. And that's how we're going to be able to be eligible for some of the new money that I hope will help us turn the system around.
You're suggesting that Minnesota is somewhat behind other states in this endeavor. Minnesota is usually a leader. How did we get to be behind in the area of children's mental health?
We have a local delivery system, 87 counties, many more school districts. A lot of other states have state delivery systems. The state is in charge of everything. They don't have county government except maybe to take care of some of the roads in the local communities. There are pros and cons to having a more local delivery system. Obviously, when you have a more local delivery system, it can be closer to people and it can be more diverse and able to respond in various communities differently to the different needs. But one of the definite disadvantages is that you have a more fragmented funding system. And we have a variety of counties, some of whom spend a lot on providing services to emotionally disturbed children, and others who spend nothing. And so in Minnesota, I think this effort of bringing people together to leverage the money that we do spend will be a helpful one.
Mm-hmm. I've heard it said that the state provides more money in the area of adult mental health than it has been in children's mental health. Could you comment a little bit on those two systems and how they relate to each other?
Well, it would be interesting to know what they're counting when they talk about adult mental health. If they're talking about the money that's spent in the regional treatment centers, then probably they're right. Again, the system that we are evolving out of has been a system of one that is designed to serve people in crisis. Mm-hmm. And so we have adults in our regional treatment centers, generally who have been committed there by the courts. And it is a very expensive proposition. We also have a healthcare delivery system that has emerged out of an acute care model. And so hospitalization is oftentimes available to people where good outpatient primary care is not. Mm-hmm. A lot of people still have insurance policies that have very high deductibles. Maybe they don't cover very much except for hospitalization. And so we see far too many people being hospitalized, and oftentimes those people are adults, and sometimes they're adults who, when they were children, did not get the services they needed. Mm-hmm. And so they're living a life of one crisis after another in terms of their emotional health.
What has been the response in the community as you travel around talking to people about this change that you see taking place in the way we're going to deliver services? What do the advocates say, the parents, schools, counties?
We are going to let those who want to do this come forward and volunteer first. In other words, this was not mandated on all 87 counties, because we know that it's a tough job. I mean, we're talking about things like changing job descriptions of juvenile probation officers, maybe. We're talking about changing the healthcare delivery system so it's not over here off by itself. It is working together with people in the school district and with parents and with county services. So it's not an easy thing to do. So we want the leaders to come forward because we want this to be successful, and we know the leadership that will come forward in the beginning will provide the models for others to follow later on. There are some communities that are very excited about this, and of course parents are quite excited about it. I mean, parents are the ones that get shuffled around in the system now, and nobody likes to be shuffled around in a system. And when we get done integrating and providing one coordinated approach, nobody should be shuffled around. There should be outcome-based providers, and people should be referred to the appropriate services. And if something isn't working, rather than being told to go off to some other agency of government and see if they can help you, the providers who can provide the necessary services should be brought in. It shouldn't be a question of families having to search for the needle in the haystack. It should be a matter of the solution being brought to the family. Families that have emotionally disturbed children have an awful lot to deal with. And usually they're in need of some services themselves because they're in crisis. And very oftentimes those services are not available.
What are some of the needs of those families, you say, with children who are disturbed? What is it that they've been asking for that we haven't been providing?
I think early on when a family realizes that they are having difficulty, that a child in their family is having difficulty along these lines, they begin to ask themselves questions about what did they do wrong. You know, somehow it must be my fault as a mother or a father that I didn't do something right. And then I think when a child goes on and on without being able to get services that are appropriate, it becomes a matter of desperation. You know, if I put my child on the bus today, is there going to be something that's going to happen where they call me up and tell me I have to come and get him? Am I going to be able to go to my job today and do my job, or am I going to have to take my child out of school today? I remember the testimony of a parent who said that she couldn't get her health care plan to respond to her needs and her child's needs. The school system was telling her that if her health care plan wouldn't change this child's medication, he could not attend school. And she went through 2 months where this child was not able to be in school and the health care plan was not responding appropriately, and she couldn't do her job for 2 months. These kind of situations create a crisis for families.
What are some of the programs that are being set up, something that's going to be easily accessed by the parents? Will staff come to their homes if they need that? Will they deal with crisis situations? Will they give them respite care if that's what they need?
The idea is for the fund to be very flexible and to design a plan that works for the child and their family, and to be able to provide whatever services are needed. Sometimes it might be a matter of providing transportation to school. An alternative transportation system can be much less costly than a hospitalization. Sometimes it might be respite care. Sometimes it might be music lessons. We have found in some of the Robert Wood Johnson Foundation demonstration projects around the country that some children do very well, and music lessons and music in their life becomes a very therapeutic part of their ability to recover. And so anything that is identified as necessary and something that the family needs some assistance with should be part of the plan and should be able to be accessed.
Mm-hmm. Are there some advocacy groups that help these parents in the areas of other kinds of disabilities, physical disabilities, or children with mental handicaps? There are some advocacy groups out there that assist parents. What about in the mental health area?
Well, one of the things that's been very helpful to me in working on this issue has been folks from Family and Children's Services in Minneapolis. They have assigned a person just to work on this issue, both working in terms of providing services to families and advocating on behalf of families, and also in terms of lobbying the legislature and pushing the department, pushing the counties to do more of the right things. So they've been doing a very good job. In addition to that, there has been foundation money that's been received by the Mental Health Advocacy Project in Minnesota, and so they also have some advocacy that they can do, especially if it comes down to, you know, having to threaten somebody legally. And sometimes, unfortunately, still too often it comes down to that.
Mm-hmm. Mm-hmm. This integration of funds, that's pretty unusual in any area. Everybody would be defending their own turf and their own budgets, and how do you get people to really trust other agencies to dole out the money the way they would see fit?
Well, the way we handled that was we gave everybody a place at the table. We said the school district has money in the pool, the county has money in the pool, the health plan has money in the pool. Then they're all players at the table. They come together and they put together a plan that they can agree on, with their goal being the child and serving that child better, and recognizing that you can't just deal with a child's emotional health when the child is in school and forget about when they're in the community. You can't just deal with when they're at home and forget about when they're in school. That it has to be a plan that works for a child and the family for all of the time that they are in school, in the community, and in the home. And I think too often each part of the system is just focused on the time that child is with them. And an awful lot of the resources are devoted to just controlling that child, making it possible to survive being there, rather than looking at solving the problems and making it possible for that child to be healthier and move on in their life. You know, there are an awful lot of kids that have things happen to them that cause them to react, and that reaction is probably normal reaction to the incidents that have happened to them. And yet we do not deal with what is going on with them. They're seen as being aggressive, being angry, acting inappropriately, being juvenile delinquents. And we need to sit down and we need to say, when this is happening, there is something wrong. And we need to back up and find those early signs. And bringing people together will make it possible for us to focus on that. And as I said earlier, it will also allow contracting with outcome-based providers. The idea shouldn't be that we have to serve people forever. Many times people can be served appropriately on a short-term basis, and then they don't need to be part of a mental health system any longer.
There's a lot of talk these days about the effects of television on children, increased violence, crime in the streets, problem with young people in schools who are carrying guns and so on. Do you see any connection between these issues and the area of children's mental health?
Oh, absolutely. This session that just ended in May of '93, a teacher came to testify on behalf of this legislation. And she said she was now working with a 14-year-old boy. And they had discovered that his problem originated when he was about 4 years old, and he was sexually abused in a daycare center. For 10 years of that boy's life, he has been acting out his anger about this incident that no one knew about until he was 14 years old. When violent things happen to children, or violence is a part of their life, it has profound effects. It is not normal to be living in a violent atmosphere, and for children to have reactions to this, maybe not acting out their emotions appropriately, but just reacting, is a normal thing. It needs to be dealt with, but too oftentimes we expect kids to deal with these things all by themselves. You know, circumstances that adults would have a difficult time dealing with all by themselves. And it's not until the child reaches a crisis stage with their reactions that we finally say, oh, maybe we should do something for this child. Well, that's ridiculous. We need to be in a preventive mode, and we need to be putting into place the flags that come up. When there's violence in a home, when someone experiences something outside their home that is not appropriate and has abused them in some way, we need to make it so okay for kids to talk about it.
Do you ever hear from kids who have been through the system?
Well, we've had a few come over to the legislature. I think we really need more to come. More often than not, we'll hear from young adults who feel the system has failed them. And you know, the statistics are there to show it. On a national level, 40% of the kids who receive services in schools because they're emotionally disturbed do not graduate from high school. They generally graduate into the correction system. And it's very expensive. Very expensive failures we have.
It sounds like the system has been in disarray. Now we're trying to remedy that in some ways. What's the next step? Where do we go from here?
Well, I'm really pleased that there have been an overwhelming number of school districts and counties that have responded to a proposal that went out to provide them with money for planning obviously when you're bringing this type of many units of government together to do something, it requires some planning. So we're at the stage now where folks are beginning to put together plans. Next legislative session that will begin in February of 1994, we expect to have some recommendations back from those groups who've been planning about barriers that there might be in the system to what they're trying to do. Maybe some of those barriers might exist in regard to data privacy laws, where they can't share information that they need to be able to share with each other. Maybe some of it might be in regard to requirements that the state places on these units of government in regard to how they do their planning. We want to remove those barriers. And so I'm looking forward to the next legislative session where we'll be moving on to the next step of not just bringing people together, but then enabling them to carry forward their plan and be successful.
When this issue came up at the legislature 4 or 5 years ago, some of the legislators were raising question about who these kids were and really were confused as to the difference between children with emotional problems and delinquency. Do you find at this stage of the game that your fellow legislators have a better understanding of the needs?
It was easier this time. I think the work for the last 2 years that the Children's Mental Health Task Force has done has been very helpful. I think some of the results that we were able to show legislators in Robert Wood Johnson demonstration projects in other parts of the country were helpful. But I think one of the things that really opened people's eyes up was the amount of money we're spending through the various systems. We were not able to quantify the money being spent through the juvenile court system. We could only document that for Hennepin County. But we were able to document what was being spent through the school system, through the county social services system, and through the health plans. And it was in the billions of dollars. And when you sit back and say, we're spending that much money, and this is what we're getting for it, legislators began to realize very quickly worrying about who these kids are is not the issue. Worrying about how we can be more effective stewards of our money and serve these kids more appropriately, that should be what our concern is. And that's how they did respond.
What advice would you give a parent of an emotionally disturbed child who was coming to you and saying at this time they need help for their child?
Well, I would say get in contact with your county, get in contact with private social service agencies that might be in your community that can help link you up with the appropriate resources. And finally, and most importantly, what I would say is don't give up. You know, it might be really a struggle finding what you need, but don't give up. People need to be pushed, the system needs to be pushed, the system needs to understand that people are not going to go away and allow their children simply to continue without receiving the things they need. And it's only when people push the system that it's going to change.
Well, this has really been a very interesting, informative exchange for me, and we'd like to thank you very much for coming here today, and thank you for all of your efforts in the area of children's mental health. Thanks.
Thank you so much for inviting me.
Thank you, Senator Berglin and Barbara Amram. Legislation such as this will do much to improve a fragmented system, helping families before a crisis in their lives is imminent. Thanks to all of you for watching All About Kids. Please tune in again.
This has been a presentation of Hennepin County Library in conjunction with the Twin Cities Metropolitan Library Service Agency.